Good afternoon, everyone, and thank you very much for your time. So I'd like to tell you a little bit about AusCann, who we are, and what we're doing. So, as Clive mentioned, so we are in the business of developing pharmaceutical products that contain cannabinoids, which are the key active compounds that you find in the cannabis plant that are used therapeutically. We have all the licences required to undertake these activities here in Australia. So everything that you need for the cultivation right through to the manufacture and distribution of these products. We have spent quite a bit of time, effort in developing the relevant expertise and IP to be able to do this task. And our initial focus is on the products for the treatment of chronic pain, and I'll explain a little bit further why we're doing that. And we're due to release these products around mid-next year here in Australia. This is a little snapshot of our company profile. So our market cap at the moment is around that $300 million mark. We recently did a capital raise. We actually also raised a further $2 million sort of in that August period. So the total raise just recently was around that, just over the $35 million mark. We've been listed since February of last year. Our board members there consist of Dr. Mel Washer. He's actually the founder of AusCann. He's a medical doctor. He was also a federal member of Parliament for many years, and when he retired out of politics there, he established AusCann. And the reason why he did that is he believed that Australian patients had the right to be able to access cost-effective, clinically validated cannabinoid medicines here in this country. And that's why he established AusCann, effectively worked with the government to get the relevant regulations in place in this country. We also have other board members, the Honourable Cheryl Edwards, I'll make a note of. She's the ex-Attorney General there in Western Australia, is also a member of our board. Our key shareholders are the Washer family members and also Canopy Growth Corp, which is a Canadian company, which I'll also touch on them in terms of who they are and why they're there. So essentially how this whole sector came about and what the opportunity here is in Australia now. So in late 2016, essentially the regulations fell into place that allowed companies to be able to cultivate and manufacture medicinal cannabis products here in this country. There was also rescheduling of cannabis and cannabinoids that allowed doctors to be actually prescribed these medications too. In terms of the opportunity for Australia, this is something that's not actually really that new or novel to Australia. We're actually the largest producer of plant-derived pharmaceutical in our opiate sector. And this whole sector is really gathering momentum at the moment. At the moment, there is an importation of Canadian medicines and also medicines from the Netherlands for patients now that's being prescribed. Our Therapeutic Goods Administration is easing processes, enabling doctors to actually prescribe these medications now. And also Australia has the export opportunity open to it. So I guess our key strategy and focus has been firstly develop a suitable pharmaceutical that doctors could prescribe and were willing to prescribe for their patients. And so our focus has been, as I mentioned, on the development of chronic pain, particular medication for that. So we put a lot of work in terms of developing an appropriate dose form for that. Our focus has really been on that distribution. So that's been the interface with doctors, educating the doctors through our medical outreach program, and establishing distribution networks. So essentially what our aim is, when these products come out in mid-next year, we can actually distribute them straight off the bat under what we call the special access schemes here in Australia, and also export those products. However, our ultimate aim is to actually move those pharmaceuticals through to get on the Australian Register of Therapeutic Goods, which then can ultimately be considered under the PBS scheme. I'll mention a couple of our partnerships that we have too that sort of we've created along this journey. So one is with a group called Tasmanian Alkaloids. These are the largest producers of opiates in the world. We have a relationship with them where we're looking at undertaking some cultivation and manufacturing activities with them there in Tasmania, as well as other potential Australian sites. The other relationship that I'll mention as well is with the Chilean group. We have a joint venture in Chile with a group called Foundation DAO. We're the only licensed entity in Chile to grow medicinal cannabis. Now, the reason why we're doing it over there is a very cost-effective source of producing the dried raw material that we need for our manufacturing capabilities here in Australia. Also, the Latin American market is a significant one. Quite a few countries over there allow medical use of cannabis, from Peru, Argentina, Brazil, and Chile. We have a relationship with a few Canadians. So the first one I'll mention is Canopy Growth Corp. So Canopy is an interesting one. They're the largest cannabis company internationally. They're based in Canada there. Canada has allowed medical use of cannabis for a good decade or more. Canopy has a large shareholding of us. Now, it has put equity into that, but it also has, in return for some of those shares, given us expertise and IP, and particularly in the whole growing space and genetics associated with cannabis. Our other relationship we have with the Canadians is a group called Jade Cannabis. This is where we do a lot of our R&D and development work in that whole cultivation and genetic space. Where Canadians are really the leader in cannabis is when it comes to genetics and how you grow it. All our expertise in terms of manufacturing a pharmaceutical is from Australia. So I'll cover just briefly the operations that we have in place and what's set up. So for us to produce these kind of pharmaceuticals, we've sort of got to be involved a little bit across the whole chain. So everything from that cultivation right through to producing a pharmaceutical product. So with the cultivation aspect, so as I mentioned, a lot of this IP expertise we've sourced from Canada. So all our genetics are from out of Canada there. We've done a lot of work in trying to create better production methods, I guess, when it comes to cultivation. And we've really developed now a good rapid growth system so we can turn around those crops in less than a 3-month period. So effectively it's like a little factory of these plants that are churning out. We're harvesting sort of every 2 to 3 months the product from them. Now we're expecting this first crop to start yielding around the end of the year. We've also put a lot of work in developing in terms of how we extract the key compounds that we want out of cannabis. Now look, this has been going on for centuries, essentially people doing extracts of cannabis. So look, there is a lot of knowledge there, absolutely. However, we've approached it really in terms of how do we make this as cost effective as possible. And we put some great Australian chemical minds to this process, and they're actually developing some new proprietary techniques here, which is really exciting. Where our key strength comes in, however, is really in formulation and manufacture. So we have on our team people that we've sourced out of the Australian pharmaceutical industry here, and we've put their minds to developing essentially a medical product that doctors would be happy and willing to prescribe, and that is also best for patients for treating their pain. What we found with medical cannabis products internationally when we first came into this space is essentially you had everything from a dried bud that someone sort of vaporised or, God forbid, smoke, which is, I would not recommend anyone smoke these products. They vaporise it, basically they heat it up, they inhale the chemicals as they're given off, through to extracts. And the extracts can be made up in an oil, in a bottle, in a dropper format. Some companies are producing soft gel capsules, which is a bit like your fish oil capsules. Now, the problem with all of those particular formulations is that they're not highly stable. So the key compounds that we're interested in here are what we call the cannabinoids. Now there's 104 different cannabinoids. We tend to focus on particular 2, maybe 3 of those with our formulations. But one thing with all these cannabinoids is they are very unstable. You put the heat, light, air, they start degrading, they start changing. So all of those formats that I mentioned are highly susceptible to change. So even your fish oil, well, the fish oil tablet equivalent, I don't know if you've ever had those and you feel over time they go a little bit squidgy. Now the reason for that is you do get air transfer through the soft gel capsule. So we have just completed our pilot work, and we were really excited to be able to sort of announce that we've developed a stable, solid capsule format for these cannabinoids now going forward. And that really is a game changer for this industry, because that means doctors can have the confidence to be able to prescribe these medications. These medications can comply with all the TGA GMP requirements that are needed to be able to produce pharmaceuticals in this country, and it's in a format that's easy for patients to be able to take. They look exactly like any of your other capsules, say like your other Nurophens in your blister pack. You pop them out, you take them. It's nice and simple. As I mentioned, we have all the required licences in place. Certainly in this sector, going back 12 months or more, this was a big topic area, I guess, in terms of what companies have got licensing to do what and so on and so forth. So essentially there's what we call the Office of Drug Control licensing is required right through the TGA. So we have these licences that are needed to operate. Sales and distribution, this is obviously another key focus for us apart from the manufacturing. All these medications are prescribed by a doctor. So you go to your doctor, they write out a prescription if they believe this product is right for you. Sounded a bit like an ad, didn't it? And essentially then you would go to your pharmacy and get your prescription filled. One of the key challenges that we have, apart from that dose form, which I believe we now address, is the knowledge of doctors and the willingness to prescribe these medications. So they haven't been trained about cannabinoids. It wasn't taught at medical school for them. I might add that the new doctors coming through, it is now in their pharmacy textbooks, which is really encouraging. But what we have at the moment is we actually have a medical outreach program. So we have medical liaison managers who are out there on the ground talking to doctors, pain specialists in particular, educating them about these particular medicines. And this is all overseen by our Chief Medical Advisor, Dr. Daniel Schechter. He's a Canadian doctor and he's been in the area of cannabinoid medicine for many years now. We also have a distribution in place with API, Australian Pharmaceutical Industries. They have a network of in excess of 7,000 pharmacies throughout the country, so we've got that distribution channels in place. As I mentioned, we focus on the area of chronic pain. Medicinal cannabis, the number one reason for use anywhere internationally is for pain management. This is also an area where we have the best clinical data to date on the use of these cannabinoids. We do have some understanding on what certain cannabinoids are doing to those receptors on the nerve cell and why they are blocking pain. In the Canadian Pain Society, they currently have this as a third-line treatment, and there's talk of them moving it up to a second-line treatment now. Our own TGA did an assessment of all the clinical data out there internationally and produced some guidance documents for Australian doctors. One of these guidance documents on the area of pain held that patients who use medicinal cannabis for non-MS, that's multiple sclerosis, related neuropathic pain, nerve pain, were more likely to experience a 50% reduction in pain and a reduction in pain scores compared with patients taking a placebo. Now that's a fantastic result. That really is. So this is really why this is a key focus for us. So we've not only got that clinical data to back it up in this area, there is a really significant need in this space. So they estimate around 8% of the population suffers from chronic neuropathic pain, this nerve pain. So that's pain that you've had for 3 months or more and is relentless and keeps going. The current treatment options in this space at the moment are severely lacking. So you have your anticonvulsants, your pregabalins, which is like your Lyrica. They use antidepressants and also benzodiazepines and opiates. Now, when I'm saying they're lacking, the problem is they seem to lack efficacy. So when they're put under the harsh spotlight in terms of how do they treat pain, they really don't stack up with their results. Also, with all of those particular medications, there are significant side effects associated with them. Now, you've probably heard quite a bit about the opioids and this crisis, certainly that the US is going through, and also Australia is not far behind. And look, some of the figures are really quite frightening in terms of what's happening with the opiates in our patient group. So when we're talking to pain specialists, they are really keen to hear about an alternative. And so that's why I think this is an area that we really focus in on. Aside from the Australian opportunity there, we obviously also have the export now too. Look, our Health Minister came out in January of this year and actually stated that we'd like to be the world's #1 supplier of medicinal cannabis. Now that's quite a very front-footed statement. However, I believe that we certainly can achieve that. The reason why is there are a lot of countries all around the world now that are allowing medical use but don't have their own production capacity being put into place, not the regulatory framework or so on and so forth. The other countries that will come on eventually are the Netherlands. However, they are only producing dried flower bud. We do believe Israel will come online at one point. However, their Prime Minister has basically closed down any talk or opportunity of export at this point in time. The German market also will come online at some point, but it's still finalising a regulatory regime. So we have a massive opportunity here in Australia. The other key thing that's in Australia's advantage is we have very strict requirements in terms of the quality of our pharmaceuticals that we produce. So we're well respected all around the world in terms of being able to produce reliable pharmaceuticals. So in summary, we're all licensed up, ready to go. We're now getting on with the job. First Australian-produced products will be coming out around mid-next year. We've got strong strategic partnerships in place to assist us to do this, and also an excellent, highly experienced production team ready to go and get this underway. We are undertaking extensive cannabinoid medicine training with Australian doctors at the moment, and we have a clear strategy and product in terms of how we're addressing that major market need. Thanks very much.